Pre-op education, expectations for surgery. Introduction. To create the opportunity for a successful surgical experience, we want to provide you with important information to keep you safe and comfortable. This video will help you prepare for your surgery and your home care afterwards. We will cover the following important topics: pre-op bathing, eating and drinking before surgery, check-in process and time expectations, what to wear for your surgery, valuables and jewelry, friends and family in the surgery waiting area and planning a ride home, post-operative pain management and prescription needs, wound care and home hygiene, who to contact if you have questions. Pre-op showers. All surgery patients must shower the night before and the morning of their procedure. Patients with select procedures will be asked to shower with a special antibacterial soap called Hibiclens prior to surgery. Hibiclens is available at a wide variety of retail stores, normally in the pharmacy section, or you can pick up a complimentary bottle at one of our Providence pre-surgical care clinics located on the campuses of Providence St. Vincent's, Providence Portland, or Providence Milwaukee. Please do not shave around the operative site for 72 hours prior to surgery. Check-in and fasting. Your surgeon's office will be the one to tell you what time to check in. In some cases, they may not be giving you that information until the day before your surgery. They will also tell you when to stop eating and drinking. For most patients, this means nothing to eat or drink, including water, after midnight. No gum or mints either, but some of you may be asked to take your medications with a small sip of water. If you smoke, please avoid smoking or tobacco products as far in advance as possible, but especially for the 24 hours prior to surgery. Clothing. For your comfort, wear easy access, loose-fitting clothing. For surgeries above the waist, button or zip front tops are preferred. Slip-on shoes will also be easier than boots or shoes that need to be tied. Just remember, clean, comfortable, and casual. We encourage our patients not to wear makeup or use hair products such as gel or hairspray. Your surgery time. Unless you are the first surgery of the day, all surgery start times are tentative. It is difficult to predict the length of any surgery, thus difficult to predict the start time of the following surgery. We always give full attention and time to all the needs of every patient having surgery. Since all surgery times are estimates, you are asked to check in about 2 hours prior to your procedure. Please come prepared with a book, magazine, handwork, or computer, whatever you prefer to keep you occupied during your wait. Wireless internet is available and there is a TV in your room as well. Please do not hesitate to ask for an update anytime you have questions, as we are here to help keep you relaxed and informed. While you are in the short stay area, you are welcome to have a friend or family member in the room with you. The rooms are small, so space is limited in the pre-op area. If you are having your procedure at Providence Hood River or Providence Seaside Hospital, please arrive 1 hour prior to your surgery start time. Jewelry. For your safety, all jewelry, wedding rings, necklaces, bracelets, piercings of any kind, including dermal, must be removed prior to surgery. Not removing jewelry is a safety concern with potential post-operative swelling, burns, or pressure on the skin during surgery. If you have jewelry that you cannot remove, please consider visiting a jeweler to have it removed prior to surgery, or if needed, we can cut off your jewelry. Valuables. Other than bringing your ID, insurance card, any small amount of cash, Please leave all other valuables at home or with your family. Hand washing. Hand washing is the best way to prevent infection. We ask that everyone, including all of our staff and your family and friends, wash their hands or use the waterless hand cleaner each time they enter or leave your room. We ask you to speak up if someone comes into your room without cleansing their hands. Please be sure to continue washing your hands once you are home, especially any time you are touching the area around your incision, and asking family members to wash their hands before and after visiting you. Please be sure that your sheets, towels, and clothing are kept clean. This includes no sleeping with pets. Home instructions. You will receive a printed copy of instructions for your care at home, which your nurse will review with you. Keep this information close by during your recovery. For questions about your care, you can call your surgeon's office anytime, day or night. Be sure to call your surgeon to schedule a follow-up appointment if you do not already have one. Because of the medicine you received during surgery, you are at risk for falling. We recommend on the day of surgery that you don't stay alone and don't drink alcohol, drive a car, operate heavy machinery, and also don't make important decisions such as signing legal documents. Again, your safety is our highest concern even after you have discharged from the hospital. Wound care. Your wound care instructions will be explained to you before you go home. Speak up if you do not clearly understand your instructions. Don't change the bandage or remove it unless you have been instructed to do so, and keep the surgical site clean and dry. No creams or lotions on the incision. Don't soak in a bathtub or hot tub until after your follow-up appointment with your doctor. Contact your surgeon's office if you have questions or concerns, especially if you have any signs of infection such as increasing redness, excessive pain, cloudy drainage at the surgery site, or a fever over 101 degrees. A small amount of clear or pink-tinged drainage may be expected. Pain management. To assure you are as comfortable as possible, we will ask you to assess your pain level. You will be asked to rate your pain on a scale that looks like this. There are many things we can do to help you be at ease. Please speak up because pain control is an important part of your care. Conversation with your doctor. After surgery, your doctor will talk with your friend or family member in the surgery waiting room or by phone. Frequently, your first conversation with your doctor may be the next day if you are spending the night in the hospital or at your follow-up appointment in the office. If this does not meet your needs, please let your nurse know. Getting home. If you are going home the same day, you must have a ride home and you must be accompanied by a responsible adult. You cannot go home by yourself, even by bus or taxi, without a responsible adult. When you are being discharged, this responsible adult must come into the unit to sign you out. Prescriptions. To ease your way in getting home and taking care of yourself after surgery, we recommend that you fill any prescriptions in advance or before leaving the hospital if possible. You also may fill your prescription at the local pharmacy of your choice. If you are having your surgery at Providence St. Vincent's, Providence Portland, Providence Seaside, and soon Providence Hood River, you may choose to fill your prescriptions at our outpatient pharmacy. You will need to have your insurance card and some cash or a debit card to cover the copay. During your surgery, our focus is on you and making sure things go well for you. Thank you for your time and attention to these important details.